A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a heated Senate Finance Committee hearing on Thursday, U.S. Health Secretary Robert F. Kennedy Jr. faced intense questioning from both Democratic and Republican senators regarding his controversial actions and statements surrounding COVID-19 vaccine policies and the Centers for Disease Control and Prevention, CDC. The three-hour session was marked by emotional exchanges and pointed accusations, as Kennedy attempted to defend his agenda to make America healthy again. The hearing was called amidst rising concerns about the direction of federal health agencies following a series of high-profile firings and policy changes initiated by Kennedy. One of the most contentious issues discussed was the recent firing of CDC Director Susan Menarez, who had barely completed a month in her position before being dismissed. Kennedy characterized Menarez as untrustworthy and claimed that her leadership contributed to the ongoing public health crisis. This assertion drew sharp rebukes from senators across the aisle, particularly when Republican Senator Thom Tillis expressed confusion over Kennedy's stance on Operation Warp Speed, which was instrumental in the rapid development of COVID-19 vaccines. Kennedy praised the initiative, yet simultaneously criticized the very vaccines that resulted from it, leading to further scrutiny of his credibility. The tension escalated as Kennedy defended his decision to replace the CDC's advisory panel with individuals he deemed more aligned with his views on vaccine safety, which many medical experts have characterized as a dangerous move that undermines public health. Senator Ron Wyden's attempts to formally swear in Kennedy as a witness were met with resistance from the committee chair, who allowed Kennedy to present his case without such formalities. Wyden's questioning highlighted Kennedy's controversial history with the committee, accusing him of stacking the advisory panel with skeptics and conspiracy theorists, a claim Kennedy dismissed as an effort to undermine his leadership. The exchanges grew increasingly heated, with Kennedy responding to criticism with sharp retorts, including a bizarre comparison when Senator Raphael Warnock questioned him about his rhetoric and its potential consequences. Kennedy's comments about the CDC's handling of the pandemic were particularly contentious, as he claimed that the agency had failed to take adequate measures to control chronic diseases, which he argued were a significant contributor to the nation's health crisis. This assertion was met with skepticism from both sides of the aisle, as many senators pointed out that the CDC's guidance on masks and lockdowns was based on the best available science at the time. Kennedy's dismissal of CDC recommendations and his public skepticism about vaccine efficacy have drawn ire from numerous medical organizations, including the American Medical Association and the Infectious Diseases Society of America, which have called for his resignation. They argue that his policies promote misinformation and threaten to reverse decades of progress in public health. During the hearing, Kennedy attempted to clarify his position on COVID-19 vaccines, stating that he no longer recommended them for healthy children and pregnant women, a stance that has been met with widespread condemnation from health experts. He insisted that his decisions would be guided by gold standard science, yet acknowledged that he would not wait for all data to be finalized before implementing changes to health policy. This admission raised alarms among senators, particularly those with medical backgrounds, who expressed concern over the implications of such an approach. As the hearing progressed, Kennedy faced pointed questions about the integrity of the data used to inform public health decisions, including mortality statistics related to COVID-19. He cast doubt on the accuracy of these figures, further alienating himself from the scientific community. The session concluded with Kennedy reaffirming his commitment to reshaping the CDC and its policies, stating that new blood was necessary to address the chronic disease epidemic plaguing the nation. However, many senators left the hearing unconvinced of his ability to lead effectively in a time of such critical public health challenges. The fallout from this contentious hearing is likely to resonate throughout the political landscape as the nation grapples with the ongoing effects of the pandemic and the future of public health policy under Kennedy's leadership. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.